live. Welcome to Back Talks. This is Dr. Sean McWilliams, and I'm so glad to have you here. If you are dealing with chronic back pain or neck pain, you are at the right place. And if you're also learning how to keep your spine healthy from the inside out naturally without drugs, without surgery, you are also at the right place. Hey, if it's your first time, welcome. Great to have you here. We're going to be talking about something really awesome, something that is the most common thing that people are always asking on Facebook, and that is, what is wrong with me? Can someone tell me what's going on my MRI? And so that's what we're going to talk about for a couple minutes today. So glad to have you here. Hey, if you are here for with us, please say hello. Leave me a comment if you have questions. I want to answer those for you. So at the end of our little presentation here today, you feel like you have a better roadmap on which direction to go, so that you feel empowered and hopeful and not fearful and scared and disempowered, and where you just feel like you don't have any direction. I want you to feel like you have direction, so you are at the right place. All right, let's do this. So please say hi in the comments. Let me know you're here, where you're from, and let me know if you got any questions. So let's get on with it. So let's talk, let's talk about MRIs for a minute. MRIs can be really confusing to look at. And I just want to let you know that because they were confusing for me to look at. And I've been looking at them for years now. When I first started, it took a lot of training. And the problem is because you need to understand anatomy really well. And then you got to be able to understand like the pictures and how it all works. And it's a lot. And most of your doctors never really go over your MRI. They just tell you what they see and tell you what what they want to do to you. And I want you to feel empowered about what is happening in your body and perhaps where your pain can be coming from and what you can do about it. And so the more you understand about your body, and the more you can understand looking at MRIs, and not that you have to be a doctor, but just some basics of it, you're going to feel much more empowered. So that's what I'm going to show you how to do today. All right, so let's get on with it here. So what we're going to do is I'm going to show you some basic anatomy so you understand your axial view. There's two views when they do an MRI, typically. Number one view is going to be looking at you from the side. So on Facebook and most of the groups, this is usually the ones that everyone's posting, it's this side view of your spinal column with, these are the bumps of your low back. So if you, or your, you can see obviously more in your low back, you can see some in the neck. If you bend forward, like this, those are the little bumps that you're going to see running up the middle of someone's back, okay? This is the bone structure. These are your discs right here, and this is one disc. These are your nerve branches that come off of the spinal cord, which we're going to go talk about in a minute, so hang in there with me. And so doing an MRI is very similar to going to the deli counter, and when they ask you, how thick or thin do you want your meat sliced? And you tell them, oh, I want it thin, or I want it medium. The same thing happens when you get an MRI, because the technician has to decide on how thick to go, how much distance to go between slices of pictures. And so usually what's going to happen, they're usually 4 millimeters in most MRIs. So what they're going to do here is they're going to take a slice. They're usually going to start out here. It's going to take a slice, and they're going to take a picture. Then they're going to move and tell the machine, go in 4 millimeters, take another slice, move on over another 4 millimeters, take another picture slice, and that's how they get your images for you, okay? Problem is that when you look at these views, everything within that 4 millimeter gap you cannot see. So that's why a lot of times if something's really complicated and a person's struggling, it's been to multiple people, we get an MRI, we want to look at like a 1 to 1.5 millimeter because we're going to get twice as many images. So that's how MRIs work. And then the other way they work is not only looking at you from the side, but then looking at you like this, which is if we were to cut you in half and look up into your body, we're going from here, and now we're going like this, and this is called the axial view, all right? And so we'll go take a look at this as well, but I'll show you a couple of things about the anatomy. Again, you have the front of the bones up here, which we'll go look at. Your disc, obviously, right there. There would be another one sitting right here probably. This is your spinal cord, and also the sac that sits around it called the thecal sac. You have nerve branches that branch off and have to get out of that hole right there. You have the facet joints that sit back here, which I'll show you in a second, and then again, the spinous processes. So that's what they call the axial view or image. And this is the one that gives you the most information most of the time about your MRI. So let's go look at a picture of it for you. So this is the axial view right here. And we'll talk about a couple of things. Number one is where you see this right here, the nucleus pulposus. That is the jelly that is inside of your disc, and it sits in here. How's it stay in there? Well, it stays in there by this thing called the annulus fibrosus. And the annulus fibrosus are these very strong fibrocartilage bands, and they're like belts. So you know you wear a belt to hold your pants up? Well, this is about 12 belts, one on top of each other, and they're concentric, which means that one layer goes on a 45-degree angle of belt, the next layer goes like this, next layer goes like that, next layer goes like that. So they're very, very strong, all right? And what it looks like when you look at it up close is it looks like this. Trying to get this set up for you there. There you go. So what you have in here is you have the jelly on the inside, and that's this part right here. And then you have these outer rings that you're seeing, okay, all around the disc. And if you look at it from the side, you can see those layers that run on like a 45-degree angle onto those discs. All right, see how they're on these angles. So that makes it very strong. I'm gonna see if I can flip this for a second, so because everything's opposite of how I want it to be for you. Let's see if that does it for me. All right, there we go. Now we're in business. So that's how it's supposed to look like, just like right there. What do we have right here? That's your spinal cord. This is your spinal canal, where the spinal cord runs through. So this little area right here, if I push that spinal cord a little bit out of the way, okay, there's a tunnel in there. And that is where your spinal cord goes through. It's called the spinal canal. On this model, you can see it much better. Okay, so this is your spinal canal, where your spinal cord runs through. So this is nice and open, just to give you an exaggeration. All right, what else do you need to know on here? So your thecal sac, which is this part right here, this green part, that surrounds your spinal cord, and this is where your cerebral spinal fluid flows, is all through there to keep your nervous system nourished. These yellow dots that you see right here, those are called traversing nerve roots. And I'll show you what those are here in a second. So a traversing nerve root is these. So you see all these little dots right here. Those are actually nerve branches that are traveling down the spinal cord. And what winds up happening is that every level, you're going to get a nerve branch off of that cord and exit out, like you see right here. And then the same thing will happen on the other side. So as you get further and further down the spinal canal, you're going to have less and less of those dots. Okay? What else do you need to know about this? Let's go look at this picture. This is the nerve branch that we've looked at. So there's two pairs of nerve branches that branch off your spinal cord at every level. And you have one over here as well coming out. You have a couple spaces right here. This orange area you see right here is called the lateral recess. It can become a big issue of pain. And then this outer part right here is going to be the outer part where it's called the foramina that's going to be going out to let that nerve branch go out. What else do you know? This is the part right here called the spinous process. Like we talked about, that's the part that comes off right here off the bone in the back. So when you bend forward, like you're going to tie your shoes or touch your toes, that's what you're seeing protrude out of someone's skin right there, okay? And the other part that you have is you have the facet joints. So let's go take a look at these. So this is one part of the facet joint without getting too technical about it. This is the other part of the facet joint. And what is the facet joint? Well, the facet joint is this. So if you look at this piece right here, and then you look at this piece right here, those two make a joint that allow your spine to glide with each other, and it happens on the same thing on the other side. So you have one piece from the bone below, the inferior articular process, and then you have the superior one, and that's called the facet joint. As you can see, that's what's allow your spinal column to glide. And if you have an injury to this, or you have a trauma at some point where those bones can't move and go through this process like this, when you bend and twist and just go throughout your life, then you reduce that pushing and pulling on the disc, and as a result of that, that's how one of the biggest ways you get degenerative disc disease and dehydration of the disc, known as desiccation. So we don't want that happening. So we want to make sure we can help restore this motion. Super, super important in keeping your spine healthy. All right, so those are probably the main things that, that you need to know about this picture. So let's go take a look at an MRI. So now we're looking at an MRI of the exact picture that we just looked at. So we have our disc up here. Okay, disc has two parts, right? So anybody remember what the parts are? They are the nucleus pulposus, the jelly, the NP, and then you have these outer rings like we talked about, the annulus fibrosus, that you can't really see that well on this MRI. This is your thecal sac. Remember, the thecal sac is filled with cerebral spinal fluid. The little dots that you see right here, those are those traversing nerve branches that we talked about. Those are, again, those little branches that are going down the spinal cord and then are going to exit out at every level. And this is where your main nerve branch comes out at, is where you see this neural foramen. Same thing right here. So this area right here is actually your nerve branch. So all of this is the nerve branch that I've shown you on this model, and you have one on the other side. So again, nerve branch there, and another one over here. And these nerve branches look pretty good. I'd like to see a little bit more arch to the back of the disc right here. That's where the posterior longitudinal ligament is. Okay, so we have some bulging of this disc, but it doesn't look like it's really compromising neurological tissue at all. So when you look at your MRI, this is about how high the distance that you should see the height of your nerves going through there. Usually around 4 millimeters, in that range. Okay, and then this is one of the facet joints that we talked about. And then here's the other one, and here's the cartilage in between. And then the same thing on the other side. You can't see this one quite as well. Okay, so that's what that looks like. And so let's talk about, how do we get pain? Where does pain come from? Well, there's two major sources of pain in the neck and low back. The number one source for most people is actually the disc becoming diseased and damaged to some extent. And I'm going to show you how that happens. The number two cause of low back pain and neck pain is the facet joint. And so let me show you what we're talking about here. And why is that? Why is the disc number one? Well, here's that nucleus pulposus in purple. Obviously, there's a major issue here. There's a tear to these annular fiber rings, as you can see, and this jelly now is pushing outward and backward. And if you look closely, you're going to see all these yellow little dots. And what those are called is nociceptors. A nociceptor is a pain receptor. So in the outer 1/3 of our discs, going around like this, all this area right here has very, very high amounts of pain receptors. So if you tear the annulus part of your disc, you tear these pain receptors, You get chemicals released, just like if your kid, falls on their knee and scrapes their knee or their elbow and they're cut and there's oozing, the same exact thing happens on the inside. And what happens is that oozing releases a chemical called cytokines, and those cytokines irritate all these little yellow dots called nociceptors or pain receptors, and you're going to have back pain. Okay? So we want to get that to heal. If it pushes past that and starts to migrate out like you're seeing right here, now we can start putting pressure onto the actual nerve branches, this orange part that you see me drawing in. So this is one of the nerve branches. So this person's probably getting pain two different ways. One from the outer 1/3 of the disc, and number two, pushing on the nerve branch. The beautiful part about that is that with proper spinal decompression done on an intermittent traction table using the right algorithms, you can have probably an 80% success rate of managing these type of issues, and you can actually do it from the comfort of your home. And we'd love to teach you and talk to you a little bit about that and see if that's a good fit for you. So I know a lot of surgeons are going to tell you you need surgery on this stuff, like microdiscectomies and things along that line, perhaps fusions, laminectomies. Please don't ever let that be your first or second or third option for correcting it. Spinal decompression has over an 80% success rate. I've been doing it for over 10 years in my practice full time, and now I've created a course to teach you how to do it from your home. So we want you to feel great, and we want you to get back to the quality of your life, not just cut bad stuff out, but actually get your body to do its best job to heal and repair itself from the inside so that you're not dealing with this stuff for the rest of your life and you feel great again, okay? So if you'd like to learn more about that, you can go to drseanmcwilliams.com. That's DRSEAN McWilliams.com. If you need to talk, if you're not sure which direction to go, but you like what we're talking about here today, hey Stephanie, great to have you here. You can go to booking.drseanmcwilliams.com, and you can get on my calendar for us to set up a Zoom call. I normally charge $197 for these right now. For this month, we're doing it complimentary because I want to help you feel better, and I want you to start to feel empowered again. And if I think Disc University might be a good fit for you, the course that we've created, I'd love to share that with you and show you how it works. And if I don't think it's a great fit for you, well, I'm going to tell you that as well. And I'm going to help you get to the right person. So no matter what, you win either way. So I only do a few of those a day. And so please take advantage of it at booking.drseanmcwilliams.com. You can get on my calendar and we'll have a Zoom call, and let's shed some light and bring some hope back into your life about what's happening. We can look at some images that you have or your MRI on there, and I'll explain it to you in plain English so you understand perhaps where your pain's coming from and what we can do about it naturally, okay? So I hope you'll share this with other people. People need to know about this. There's so many people. You realize that almost every second to third person that you walk by or see has some form of chronic neck or back pain. And we don't want them living on opioid medications and drugs or having unnecessary surgeries because none of their doctors told them that there was something that worked extremely well and that is non-invasive and non-surgical and you can do from the comfort of your home. So if you want more information about it, reach out to me, please. We want to share that with you. And you can go take a look at some of the information too on our website. So it's great to have you here. Stephanie, always great to have you here. Thanks for your support. And we will see you next week at the same time. But hope you like this. Hope it brought some value to your life.